Good afternoon, everyone. I'm Terry Malenfant with TCA Genetworks, and I am excited to be moderating this fact-filled and what I hope will be a visually engaging panel discussion today about how to conduct a safe and effective testing program for your business, healthcare facility, or school during the surging coronavirus epidemic. The new testing management program we're going to discuss today is being used across the country, and it's called Aura. Aura utilizes Genetworks Laboratories molecular testing. Genetworks is a CLIA and CAP certified molecular laboratory, which is currently delivering COVID-19 diagnostic test results and antibody test results in 24 to 72 hours or less, with an accuracy level in the 99th percentile. And I've just learned that Genetworks reached a milestone this week as it has performed 1 million COVID-19 tests for Americans in the past 5 months. Now, the Aura program uses special software that will be explained in detail today, and this software does a lot. It expedites test result turnaround times, reduces laboratory process time, and allows large population customers, including municipalities, state and federal governments, universities, corporations large and small, assisted living facilities, and others, to manage their COVID-19 compliance and the testing of their entire workforce, student, or patient population. This is meant to be an interactive panel discussion today, so I want to encourage all of you to ask questions. We will be pausing a couple of times as the program unfolds to allow for your questions, and then at the end of the program, we will have a full-blown question and answer session. It's my pleasure now to introduce our panelists. First, we have Steve Paolucci, who is the Chief Architect and team lead of the Aura software. Welcome, Steve.
Thank you, Terry. Pleasure to be here.
Great. We also have Matt Etheridge, who is Vice President of Sales and Marketing for the East at Genetworks and has more than 18 years of experience in sales and leadership positions in the medical marketing field. Welcome, Matt.
Thank you for having me. I appreciate it.
Matt, I'm going to start with you. There have been a lot of news reports about labs struggling with long testing turnaround times. Can you start by updating us on how quickly TCA Genetworks is providing COVID-19 test results to patients now? And also, if you can update us on what kind of capacity the lab has for testing large populations.
Sure. First of all, thanks everybody for joining today. Really appreciate you all taking the time out of your schedule to be here. I'll just start by saying this. There is no book on how to do 1 million COVID tests in 4 months or how to go from 500 samples a day to 20,000, right? It just doesn't exist. We looked everywhere. We looked at Barnes & Noble. We looked in the Apple store. It didn't exist, right? So what we've been doing over these last 4 months is I mean, every waking minute is how can we improve and how can we ramp up from a machine standpoint, from a manpower standpoint, infrastructure, automation, you name it, because we could see what was coming, which the surge of folks that needed their results, needed them quickly. So Genetworks has been engaged in that fight for the last 4 months. And our goal has been to have not just good turnaround time, but to have industry leading turnaround time at TCA and Genetworks and really set the standard for the industry, not just be a part of it, but really to really set the standard. So where are we today? Right now, we are 24 to 72 hour turnaround time from when we receive the sample. What I will tell you is we track this turnaround time on a daily basis. And for the last 3 weeks, for example, looking at those turnaround times, 95% of what we actually received at the lab was actually resulted next business day. So we're doing a phenomenal job right now on turnaround time, but we're continuing to ask ourselves, how can we do it better, right? And Aura is going to be part of this, and Steve can show you how. But we know this is near and dear to your patient's heart. We know it's near and dear to your heart. So that turnaround time is critical, especially when you read news articles that other labs and other entities are really struggling, and we want to be different. From a capacity standpoint, we right now we're doing 15 to 20,000 samples per day, and we have a current capacity at our right now, our turnaround time, to do over 50,000 per day. And in the near future, in the next coming weeks, will be over 100,000 capacity. And where we are right now is we're well overstaffed, in fact, because what we're doing, not just delivering turnaround time now, is we're prepared for what we believe will be the next surge, because it's not a matter of if, but when there will be another surge of cases. We've seen news articles that, kids have gone back to school, for example, in some colleges. We've seen outbreaks. So there will be another surge, and I want you all to know that TCA Engine Networks is prepared to meet that demand. One of the most important things, too, is, over the last 4 months, not just from a turnaround perspective, we've really tried to listen to the customers. We've tried to listen to the pain points, the needs of you and your patients, to figure out what we can do better. Because you're either, standing still is not really an option in this space. You have to be constantly improving. So about 6 to 8 weeks ago, we had one of these webinars, and we talked about some of our new features, our patient portal, our texting applications, and some really cool things to kind of take it to the next level. What Steve's going to go over today with you with Aura is really the next evolution of taking yet another step to deliver outstanding service to our customers and to the patients that they provide service for.
Matt, do you give us a sort of 10,000 foot, before we turn to Steve, overview of how Aura is helping businesses and schools right now as they return to work in classrooms?
Right. Well, bottom line is, testing is one thing, and it's great that labs like TCA Engine Networks can offer testing, but there are tons of other labs that can do testing for you. The question is what else do you really need? And what Aura can do is come in and really serve as, a data management system, a scheduling platform, really an all-encompassing program to give customers exactly what they've been asking for as we've worked with them for the last 4 months. Again, trying to listen and say, what do you need? Not make a program that works for us, but make a program that works for you and your patients.
Thanks, Matt. Steve, if I could turn to you now for some detail on what I understand is the user-friendly Aura software that you created. But first, can you tell us why you developed this software program? What was in your head?
What was in our head? That's a good question, Terry. 55,000 Americans died during the Vietnam War. Contrast that to 170,000 Americans that have died just in the last few months alone from this COVID-19 crisis. Make no bones about it, this is the single most devastating crisis, health crisis that our nation has ever faced. And not only is it the greatest health crisis that we've ever faced, but it is the greatest economic crisis that we've ever faced. The definition of a recession is 2 consecutive quarters of negative growth. Now, during the Great Depression, the GDP contracted by 30%. That's a lot, but it took 3 years. We've done that in 2020 alone. So it is our mission to turn the economy around, to get people back to work safely, to get kids back to school safely. We are working tirelessly, night and day, with establishing this program of sequential testing so that everybody can return to life, because we don't have a vaccine yet. This is what we have. This is the solution. And I'm telling you, this is working. We are seeing clients all over the country that have been sitting on the sidelines for 6 months. And now they are actually working because of our program. We've set up our program, with various organizations, institutions, and we have people who are actually working, and they're doing it safely. So that's what was in our mind. That was our vision, and that is our mission.
Thanks for sharing your motivation with us. I know there's a lot of people wanting to see how the app actually works. So I'm hoping you can walk us through the Aura app and share some of the details.
Absolutely. So I'm going to walk you through Aura. So Aura is our sequential testing and sample management and certification platform. Basically, it establishes a program of sequential testing and certification for all your population, for all your people. Initially, we establish a testing frequency, which can vary according to your job. So an organization can have different testing schedules for different people, whether it's faculty or staff versus students or contractors. It's very flexible. We provide the ability to schedule, capacity management. One of our goals was to make that whole scheduling process very quick and easy, and to eliminate lines. So I'll show you shortly how we achieve that through our scheduling platform. We also provide data, and the data helps your organization make decisions. So if you're testing people and you're seeing trends, you're able to make informed, intelligent decisions on how you're going to proceed week by week, month by month, and you can track your progress, and you can see those numbers go down, those positive results, until everybody is getting a clean bill of health. So as I had mentioned, how does Aura help your organization? Well, first of all, we can set up all your locations in the system and set up scheduling. Users are able to log into the app and pick available times and schedule, or you could do that on the back end. We also do sample tracking. So when a user, patient, schedules their appointment, they show up, and that sample is collected. We are tracking it all along the way. Nucleus software platform essentially works like this. We establish a baseline interval, and that, for example, in this example, it's every 7 days. A person will be onboarded onto our system. They'll be able to download the app, schedule their test. The employee is then tested, and they're going to get a result. It's either going to be positive or negative. If they're positive, they are not permitted to work. They go into quarantine, and then whatever the quarantine flow is, CDC is now recommending that people coming out of quarantine don't get tested for at least 3 months. If they're negative, the patient is certified. They're certified back to school. They're certified back to work, and then they will be advised to schedule their next test. So in this case, they would have to test again in 7 days. All of this rolls up into a variance reporting dashboard. We also have a system of alerts and notifications and so on. So I'll be showing you that shortly. Aura is available on Apple and Google, so the App Store, and as an Android app. It's also available as a desktop app, web app. Essentially, a user can sign up, or we can batch sign up people for the organization and provide them with usernames, and they can set their password. Now, one of the best things about the Aura platform is the lack or elimination of paper. So all HIPAA documents, for example, authorization to release protected health information, informed consent for specimen collection and lab testing, parental guardian consent forms for minors, all of this is available as soon as the user logs into the app. So there's no handwritten signature or anything like that, and it's immediately available to the user as well as the administrator. And once the user gets past the paperwork, which should only take about 5 or 10 seconds, they're able to find a testing location. And so we can locate the closest testing location to them, or if there's only specific locations that your organization wants to define, those are the ones that will show up here. In any case, they can select from available time slots. These time slots are all capacity based. So for example, if you could, if you were testing 100 people or 120 people per hour, you could set every time slot to accept 30 people. Once that time slot is filled, it will gray out and the user will be able to, it's a first come, first serve. So they'll be able to select from others. And this really helps manage the flow at a testing location.
So Steve, if I could jump in here real quick, one just a real world example is working with colleges and campuses where they have to test an enormous amount of folks, and they may have 3 to 4 different collection sites on that campus, as an example. Or maybe you're an employer and you have multiple lines and different areas of folks being tested. The great thing is, and Steve mentioned earlier about trying to reduce those lines, is being able to make sure that someone doesn't go to a testing site that's already full, right? We don't want that to happen. We'd like for them to be able to say, okay, this specific site, there's no slots available from 10:30 to 10:45, but here's a location that's a mile away that I can go get tested at that specific time in between my classes or on my lunch break, right? So just again, trying to eliminate those wait times and make things very streamlined for you, the organization, as well as the patient, so they're not frustrated.
Yeah, since we've implemented this, I mean, it is just night and day. The situation around these testing locations, the chaos and confusion that we were, that you'd see before, has been all but eliminated. So the user has a centralized dashboard, and this summarizes basically all of their progress, all of their activity, how many tests they've completed, when their next test is, due. It would be here that they can do their daily symptom check, which is our report health update. They can update account information. We also have the ability to load insurance information, as well as other resources. For example, the CDC portal. We can also customize this. So if you have an internal intranet with resources, we could link those in right here on their dashboard as well. So the health report, and these symptoms are updated regularly. So what you're seeing right now is actually a little bit out of date. There's a few more that the CDC has added, but the basic idea is the user can go through and check off any symptoms that they are experiencing. This rolls up into a report, and you'll get alerts for your population to see if anybody is checking off more than 2 or 3. Depending on the combination, some symptoms are weighted differently than others. And then based on those results, they will be advised that they need to either test immediately, don't report to work, don't come to school, contact the admin office, or if they don't have any symptoms, they're fine. They can come right in. So
Steve, this is really important because it goes right in line with what the CDC is currently recommending for back to school efforts, back to work efforts. These symptom checks are actually a big part of what the recommendations that have recently come out are suggesting, which is, not every person has immediate access to a test, but by doing these symptom checks, you could potentially eliminate folks that may come to school or come to work that may potentially have been exposed or may potentially have the virus that can spread it. So this is something, again, it's TCA Networks and AURA in collaboration trying to be right in line with what the CDC recommendations are.
Steve or Matt, I do have a question from an audience member that pertains to scheduling testing. The question is, how many testing locations are there in the Northeast?
Oh, I can talk about the locations that we have been working with in Aura are specific to organizations. So we have been setting up locations right on campuses, right at office complexes. So as of yet, we have not opened public locations.
So what I would jump in and say is, first of all, whoever asked that question, thank you. At the end of this presentation, my contact information is going to be presented, and we'll make sure that you're followed up with to find out exactly where you are located in the Northeast, because we have a lot of organizations, employers, physicians, hospitals that utilize our services and can utilize Aura. So we'll reach out to you individually, and we'll figure out exactly where you are and point you in a direction where we can help you.
Thank you, guys. Steve, do you want to keep going? We don't have any other questions at this time.
Okay. So for billing, the user can enter in their billing, their insurance information. We take a picture or photo of the card. That way, we're able to run it through billing. This is obviously depends on the policy of your organization regarding who's paying. We pre-populate the carriers into the form for easy entry. So if they start typing in blue, all the blues will show up, and they'll be able to easily add their insurance information. As soon as results are available from the lab, they are immediately sent to Aura. They're sent to the user. The user will receive a push notification as well as an email saying, you have a result. And we don't say what the result is in the email for privacy reasons or in the push notification, but we direct them to log into the Aura application, and here they can see the result right away. Now, they also have access to their testing history. So you can see each and every test and track your testing progress over time. So we also have a capability that we call TCA Preferred, which is a national easy pass for quick user access. And what we're talking about here is, this is a sequential testing and certification program. So we are defining users as certified if they've tested negative and they are in compliance with their testing cycle, or they're denied. So denied does not necessarily mean that they've tested positive or anything like that. It simply means that maybe the user hasn't tested yet, or is out of their testing sequence. Now, we have scanning hardware, so you can, if you're monitoring a perimeter, for example, an office building, and you want to let people in, you can simply scan their phone and see if they're access granted or denied based on their testing or based on their certification status. We also use this code to be able to check people in at the testing location. So this just keeps it quick and easy. So as people are arriving at the testing site, they just hold up their phone, they get scanned, their chart's pulled, is pulled up, we verify that person, and then we're able to get a sample from them and connect it to that user and send it in for tracking. But essentially, this is an optional feature, and it's something that we found is very helpful for controlling access to certain things. So cafeterias, dorms, buildings, offices, sporting events,
You guys can probably imagine a lot of the hot topics right now, are fans in football stadiums, right? Is college football going to be played? Is the NFL going to be played? You see Major League Baseball doesn't currently have fans. We envision this technology could be incredibly helpful to maybe a university that, is not going to have a sold out house, but maybe they want to let 10,000 of their season ticket holders in, and they can control who can get in and who can't based on if they've had a test or not. You can make sure that you're not letting anyone in the stadium that hasn't been tested for COVID. So there's a lot of utility with the application that we're not going to dive deep in today, but again, I'm sure over the next coming weeks and coming months, this will continually evolve, so we can make this even more user friendly for a variety of folks like colleges, athletic departments, things like that.
So the user also has access to their certification status. So if they need to quickly show, for example, if they're entering the classroom and the professor wants to see that the people coming in are certified, this is just a quick way for them to show, hey, I'm certified. My certification is good for another 3 days. That allows them to get access. And this is really good. So in the event you don't have these scanners, it's more like, if it's smaller locations, it's just a quick way to be able to verify somebody's certification status. Now, on the back end, we have an administrative site, and I want to talk a little bit about the reports. Now, here you can see we have this back to work variance report, back to school variance report, and you get a bird's eye view of all of your employees, all of your population. So you can see, if they've been tested, if they're negative, if they're positive, you can filter on any of these, and you can also send notifications directly from the app. We also have the ability to report on scheduling, so you can see appointments, you can see who hasn't scheduled, and send alerts based on that. All of this data you can export into Excel format. So if you need to import that into an internal system, that's something that you can do through this system.
Yeah, we've seen the demand here increase for this level of information with a lot of the state mandates and local executive orders and whatnot in a variety of areas in the country. And one of the challenges is if you have 100 employees that you're mandated to test and 2 of them don't show up, you want to be in compliance, right, as much as humanly possible. But sometimes without a system like this, it's really hard to identify who didn't get tested, right? So what this can really do is it can really show you and illuminate, we should have tested 100, but we tested 97. Who are the 3 that we're missing? It's these 3 folks. They need to be tested, right? So this has been a great management tool for folks to utilize that have put this into play to really give them a lot of great information right at their fingertips instead of having to search and dig and figure out, maybe who didn't show up for their test.
Steve, I do have a question relating to this area, some of which you've answered, but some not. The question is, does the administrator client have access to all users regardless of HIPAA, or is there a privacy setting?
There are a variety of roles. So the administrative interface, we can control access. Obviously, they have access to their own populations, but it would only be like an HR that would access this information. I think it would be, I want to give you just a little live, so you can get a taste of what this actually feels like with a clickable demo, and show you what the user experience really is like, because I think you get a better feel for it than just seeing a bunch of slides. So, first of all, the user can log into the application, and it will find locations. So you can either type in a location or it will automatically find them for you. So a user can log on and they can find the nearest location. They can schedule, book their appointment. It lets them know. So this will send them a calendar invite. It will also send reminders on the day of that appointment. Now, when a result is available, they get an alert, a push notification, and they can view that alert. They can see that they're negative or positive, and they can also see all of their history. So you can dig into the actual details of that result. Now, once you have your result, you have your QR code, and this is how you get access. When you show up, this is how you check in. It's also how you get access into a location. So you're scanning, you're going to scan either verified or denied. And you have access to your results or your documents. So all of your HIPAA compliance forms are in the application for you. We can do our report health update and go through, check off symptoms, and submit that health report, and then receive a recommendation based on what our symptoms were. Insurance information can be edited. I mean, that's essentially it. You can edit your account information. You can manage your schedule. If you need to cancel or reschedule, you can do that as well. But Aura is very simple to use. It's very easy for the user to get through, to schedule appointments, to get their results, and know what they need to do if they get a specific result or if they have a specific set of symptoms. We're directing them, we're guiding them all along the way.
Okay, great, Steve. So a couple of questions that came up. I think first we'll go to cost. Matt, if you could tell us, this is such a great program and very exciting to see all the details. How much does this program cost?
This is just part of our testing platform, so there's no additional cost to utilize the application. We see this as our opportunity as TC Agent Networks to offer better service and a better customer and patient experience.
Great. Also, back to testing center locations, we have a question, sort of a follow-up question, and that is this program only available in the Northeast right now?
This program is available in all 50 states. So this can be rolled out with any employer group, any organization, whether it's a college institution, healthcare facility, private practice, drive-through, assisted living home. We have the capability to customize it based on your needs and your patients.
Great. Matt, maybe you can tell us, because I don't have another question, or I have one more and I'll get to that one. But can you tell us about, not naming them, but can you describe how some of your existing clients are currently using the Aura app for testing?
Yeah. Well, we mentioned earlier the college campuses. That's been obviously a very hot topic. And we have several institutions that are testing on a very wide scale, and this app has been, absolute game changer for them, right? From a scheduling perspective, from a symptom management standpoint, but also results. I mean, it is very challenging as an administrator, as a doctor, to deliver the results for 1,000 patients. It is a very time-consuming, painstaking task, and having these results with limited to no paper in the hands of not only the administrators that need to see it, but also the students or the patients is critical. So we've seen a ton of success there. We've seen a lot of success with employer groups, setting up scheduling cadences. And really, again, the app is customizable. So if you're testing every 7 days or every 14 or every 30, it can be customized based on your specific needs. And we've really seen a lot of employer groups, really love this testing. Just the information that it gives them and the ease. Everybody wants something on their phone. Everybody wants things to be easy. We found that with all the things that we did in the beginning with web portals and all that, you still have to log in and go online. People want things simple. It's the age that we're in. So whether we're talking about, college campuses or, group independent living homes, or whether we talk about employers, this has been useful for pretty much all of the above.
Thanks, Matt. There's a couple of questions, and they're sort of related back to the HIPAA and privacy issues, where patients have to give consent for people to see their results. So how does it work with administrators? Will administrators be alerted when one of their, for example, employees has a positive result? And how does that interface with HIPAA? Not in terms of legally, but just in terms of, is there a button a patient would push to give consent for the administrator to have those results?
Yes. So the very first thing upon using the application, their very first login, they need to fill out these consent forms that gives access. So I'll just share again if I can. Well, so we have basically the typically the authorization to release protected health information is one, and then of course the informed consent to specimen collection and lab testing. So that first one, authorization to release protected health information to the employer, is something that they do sign at the onset, and they cannot get past that form. They have to go through that in order to use the app, in order to schedule, and in order to show up and take that appointment. So that is all handled up front.
Great, thanks. I do have another question about whether insurance pays for Genetworks testing. Perhaps Matt, you could address that.
Yes. So the answer is always, it depends, right? So we do bill insurance as a laboratory. We bill all the private insurances, Medicare, Medicaid. We bill the CARES Act. It just is dependent on symptoms and physician order, right? Are the things that we need in order to bill insurance. But I think probably if you look at the totality of our business, probably 70% of the business is business that we bill insurance directly. And if you provide that, we will bill the insurance. And then probably the other 30% is contracts that we work directly with facilities that pay us directly for the services that we provide for their patients.
Great. If you have any other questions out there, please send them in. I don't have any right now from the audience. Steve, could you possibly just outline some of the security protocols that are built into the system? I think people might want to know about that.
Sure, absolutely. We are HIPAA compliant, and we've gone through a very rigorous process of ensuring that all data is encrypted. We run penetration tests periodically, vulnerability scans, static code analysis. We have password complexity requirements. For admins, we log people out after a certain period of activity. So we just have a number of policies that we put in place to make us HIPAA compliant.
Great. And I think you did address this, but the question's been asked whether the app is customizable to a particular organization.
There are various configurable options. For example, if an organization has a specific message that they want, if you receive a positive result and they want to have a specific message to that individual, we can configure that message in Aura for that company or for that policy for that individual. Same with the symptom checker. And all of the documents, of course. An organization can have as many documents for signature as required. We are also looking at white labeling options. We've worked with a lot of organizations that have requested customizations around reporting, an export, data export, periodic exports that they can ingest into their own systems. We definitely have done quite a bit of customization for our clients.
Great, awesome. No other questions out there right now that I've received. Matt, I'm just going to give you the opportunity to, since you've been working with businesses, college campuses, and other organizations with this app, just tell us about our clients' satisfaction with the app.
They love it. Again, everybody wants things simple directly to their handheld device nowadays. And this is just another step, and it's an example of us listening and trying to deliver something that's unique in the space. Because look, while other labs are not adding capacity, because it's hard. It is hard to have a 24 hours a day, 7 days a week lab operation